Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.
It's getting permission to hug your grandma or to go back to work or to have a wedding with friends and loved ones.
And eventually you will probably be able to go to, your drugstore close to you and be able to get a COVID vaccine. Look at who has, the most influence, like LeBron James could get a vaccine, I don't know, Taylor Swift. It'd be a really good idea.
Whether it be celebrities or, political leaders, that does help to instill confidence in vaccines.
We need to treat all of these concerns as legitimate perspectives. Combative and divisive might be the current norm in political discourse, but that's not going to work when we're trying to educate the public about a vaccine.
I'm Sarah Fenske. This is St. Louis on the Air. And before we move on, I want to remind you that the biggest source of St. Louis Public Radio's funding comes from listeners like you. Because you value what you hear on St. Louis on the Air, donate today. Go to stlpr.org/donate. That's stlpr.org/donate. Maybe you felt like Friday was the best day you've had in a long time. That's the day the Food and Drug Administration approved Pfizer's new coronavirus vaccine for emergency use. Or maybe it was Monday that had you crying happy tears. That's when the very first locals got their literal shot in the arm. But news of the vaccine isn't all celebrations and sanguinity. There are also life-changing decisions to be made. There are questions of who gets it first and who has to wait. And there are challenges in how to persuade those people who resist taking it. On today's show, we'll explore the ways these issues are playing out locally. We'll talk to a WashU researcher about what it will take to get buy-in from the most vulnerable populations here in St. Louis. And we'll talk to a local physician who has concerns about who's being left behind. First, though, let's get an overview of where we are today. St. Louis Public Radio reporter Sarah Fenton was at Mercy Hospital South as the first people in the St. Louis Metro got their shots. That includes the Reverend Bill Carty. He's a chaplain at Mercy South, and he received his vaccine on Monday.
I think it is a mini miracle. It took 4 years for the measles vaccine to kick in, and we're just doing it in 25% of the time. And it's a worldwide epidemic, plague, as we know, and I didn't really see a light at the end of the tunnel. And now I see it, and I feel it. It doesn't hurt at all. And those needles must be very sharp, because I didn't feel it.
And that is the Reverend Bill Carty speaking to Sarah Fenton Monday at Mercy Hospital South. And Sarah joins us today to tell us more of what she saw. So Sarah Fenton, welcome back.
Hello.
I love the Reverend Carty describing this as a mini miracle. Did the people you spoke with on Monday have that same sense of awe and gratitude?
Yes. And so I have been reporting on hospitals for, months and months and months and months at this point. And this was the first time I was at a hospital and it felt anything but like stressed and like it was the first time I had felt joy from health professionals for like a really long time. Like it was just and it wasn't a huge celebration. It was still a little low key. I mean, I think that hospitals are definitely keeping in mind that there is still a pandemic going on, and it's not like this is like, time to, it's time to celebrate, but it's not like, the end of the line. But, like people were posing for pictures and they were laughing and high-fiving, or, well, not really high-fiving, but they were like doing that thing with their elbows where they like bump their elbows together because they don't want to touch their hands.
They're still mindful of germs.
It sort of had the feel of like an office Christmas party. I don't know. Is that weird? Like where everyone's like kind of taking a break and they're having a good time, and it was fun. And on Monday, only 20 people at that hospital got the shot. So it wasn't like there was a line down the hall or anything. But, it was sort of this initial raft of 20 people that were supposed to be representative of all the different types of workers inside of the hospital. And so the mood was definitely very different. It was very, you could tell this was something that people had been waiting for a long time.
Mm-hmm. Now, one of the people you spoke with was Nicole Boyer. She's an ICU nurse at Mercy South and one of the first to get the vaccine.
So I actually didn't know that I was going to get the vaccine. So I was approached this morning about it, and I was very excited about it. So I've been waiting for this.
Who told you? How did that happen?
My manager and director had asked me if I would be willing to do it, and of course I said yes, because I've been waiting for this vaccine. We need something.
So that's Nicole Boyer, an ICU nurse at Mercy South, saying it was a surprise. She came in that morning, didn't even realize she was going to get the vaccine. Was that the case for others you spoke to as well, Sarah? This was sort of a pleasant Monday bombshell that dropped on them.
I think probably. I know that Nicole was the only person who talked about it, but the vaccine had only come in like 4 hours earlier. And so it wasn't like it was sitting there waiting for people. Like as soon as they got it, they were like, we're going to start giving it out. So it makes sense that people were surprised because the timeline was so fast. Like I was originally going to take Monday off because I had worked all weekend because the FDA only approved this Pfizer vaccine for emergency use like late Friday, like Friday evening. And I was like, oh, it'll take a little while for it to like get here. And then, it comes into these hospitals and Mercy received it like 8:30 that Monday morning. And so I think everyone was sort of surprised at how quickly everything rolled out because originally people were thinking like, oh, sometime late this week, it'll, but it just, it was so rapid that I think it took a lot of people by surprise.
So walk us through some of the priorities here. I know 3,000 doses went to Mercy South. 51,000 doses are supposed to be arriving this week from the federal government. Do we know where the rest in that initial batch have gone and are going?
I don't know exactly where every dose is going, but there's a limited number of sites. It's because, for one, this Pfizer vaccine is the one that needs to be stored in a super duper cold freezer, like 90 degrees below zero. And so, like your average clinic might not have that capacity to store these vaccines in like a super deep freeze. And so most of these initial vaccines are going to larger health systems like Mercy, like BJC, like SSM that are they're big hospitals, they have these freezers already, they're able to store them. And also healthcare workers are first in line to get this vaccine. And so this really, it's proportionately still a pretty small shipment, this very first one. And it's only going to like a limited number of how, for the most part at least, it's big hospital systems.
And do we know what happens after that? How long is it going to take before we get to, say, the second round of dosing?
I know that the state health department has said they expect they've said they expect sort of hundreds of thousands of doses by the end of December or early January. So in the next 2-3 weeks, they're expecting to get, the number that they give is 349, like mid 100,000s. And those will be distributed more broadly. But still, again, it's this initial Pfizer vaccine has specific needs in terms of storage. And so that's going to sort of one arm of the health world. And then this next vaccine that the FDA is expected to approve is from a company called Moderna. And the good thing about this vaccine is it just needs to be stored in a regular freezer. So it doesn't require this super deep freeze. And so what will happen with that is that will likely go to clinics and nursing homes that don't need to have that storage capacity. And so once that is approved, they're expected to approve it sometime this week. that will also up the numbers of what will be coming to Missouri and what will be available for nursing home and healthcare workers and staff.
Okay. So I am intensely jealous of these healthcare workers who are getting this vaccine. I'm very happy for them. Don't get me wrong. They absolutely deserve it. But I thought it was interesting to hear Nicole Boyer. She's the ICU nurse that you talked to. And it was interesting to hear her tell you what she hopes comes out of this vaccine.
It's been a really hard year for us, seeing a lot of unsuccessful discharges, I guess you could say. So I really am looking forward to people getting vaccinated so that it'll alleviate the symptoms and kind of put less stress on the hospitals so that we can give the care that these patients do deserve, because we're all mentally and physically tired.
So that's Nicole Boyer. She wasn't talking about getting her life back and she wants to go out to dinner again. She was talking about the strain on the hospital. Was that a common sentiment with the people you talked to on Monday?
Yes, because it's all connected. These people, it's not like you go home and you can cut off your life from your job. And so it's all connected for them. And also, like Nicole and she works with coronavirus patients. She talked about unsuccessful discharges. Mm-hmm. And what that means is people who die. Mm-hmm. And, I did a story a couple weeks ago about how all of this death is really affecting people that work in hospitals. It's affecting their mental health. It's affecting their physical health. And it's rough to see 5-6 people die during your shift. That's not normal for a lot of these people. And so they're really excited for everyone to get a vaccine because that signifies that they won't have to deal with that as much. They might be able to get things might be starting to go back to normal for them eventually. And that's something that has really been hard on them. And you could hear it in Nicole's voice. She just sounds like super tired. And she's just like, I'm ready for this to be done.
Yeah. You also talked to Dr. Amina Akhtar. She's the chief medical officer at Mercy South. And here is one thing she told you.
So this vaccine is the game changer we've been waiting for. I mean, there is palpable excitement at the hospital. After months and months of this pandemic, we have a safe, efficacious vaccine that as we start immunizing day one today, within months, this pandemic will get under control. And so that's why I think we here all see it as an honor to be able to represent our coworkers, our family, our friends, and get this vaccine.
And that is Dr. Amina Akhtar, Chief Medical Officer at Mercy South. My guest today is St. Louis Public Radio health reporter Sarah Fenton. She got to speak to many lucky healthcare professionals on Monday, these people getting the vaccine. But when we come back from the break, we're going to talk to somebody who is still waiting their turn and talking about a different side of this coin. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.
And now back to our conversation. We've been talking about the vaccination campaign now underway here in Missouri, and helping us make sense of that has been St. Louis Public Radio health reporter Sarah Fenton. We'll get back to Sarah in just a moment. We'll also take your calls if you want to join us. We're at 314-382-8255. That's 382-TALK. Our phone lines are now open. But first, we have a different perspective on this, and this comes from healthcare professionals who are being left out of these initial distributions. Joining us today to talk about that is Dr. Mimi Vo. She's an internal medicine physician at the Vo Medical Clinic. So, Dr. Vo, welcome to the show.
Thanks for having me.
So, Dr. Vo, have you been hearing from friends at large hospital chains who are getting their vaccines?
Oh my gosh, so excited for all of our physician colleagues and our nursing colleagues and all of the wonderful people in the hospitals who are able to get vaccinated. I get chills every time I see a picture of a friend of mine that I know and they post about it on Facebook or social media that they're getting their vaccine. Very exciting.
But I understand there's also a flip side of this for you. There's maybe one person in particular you're worried about, but also a bigger picture here. What's going through your mind as you see people get these vaccines?
Yeah, so maybe last week, or maybe this has been about 2 weeks now, there was a physician who works at a local urgent care, and she posted on a social media platform that is shared among St. Louis physician moms. It's a St. Louis physician mom group, and she had asked about the vaccine and what was going to happen for someone such as herself who works in an urgent care seeing 20 to 30 COVID patients daily. She's swabbing 40 plus swabs a day and seeing 80 to 90 patients per day. And what will happen to her as she's not affiliated with any of the local hospitals. And that really triggered something for me because though I do have staff privileges at Mercy South and will likely be on a list to get the vaccine, my father is not. And he's a 77-year-old physician who was still working up until the pandemic hit.
So tell me a little bit about your father's situation. He's obviously, just by virtue of his age, he's a little bit more high risk. Is he in a situation where he might be exposed to this?
Absolutely. So he is 77 years old. He does have asthma and diabetes, and he works still at our office. And in March, when we started seeing patients with COVID-19 in the United States, my sister and I said, Dad, I think it's time for you just to maybe take a step back and let's just see what happens. So in our office, we're an internal medicine primary care office. We see patients who are having respiratory symptoms suspected of COVID-19, or they got diagnosed with COVID-19, and we're taking care of them to monitor them and watch them as they go through their illness. And we're trying to prevent patients from having to go to the emergency rooms or and trying to take care of them from home. So thus, my father working in the office would definitely be exposed multiple times a day. And the more exposure, the higher the chance that someone would get ill.
Well, it seems like he should be somebody who can get this vaccine. Have you been able to get any answers into what sort of weight he might be looking at?
No, not at all. And the physician that I spoke about at the urgent care, she reached out to some high-level people at BJC and SSM and whatnot, and they have pretty much said, we actually didn't think about these people, those who are in the healthcare system who didn't have privileges, or, for example, my medical assistants or nurses who don't have privileges at the hospital. So I did reach out to the Department of Health and Senior Services. All of these physicians have, for themselves and their staff, and there's about 40 of us physicians now in the St. Louis area who are in the same kind of boat for us and our staff. And we just have been told that the supply is limited. We don't know yet what will happen and how the outpatient clinics will be able to get a vaccine.
Boy, it's interesting to think, not just the 40 of you who are in this boat of being smaller independent clinics, but there are so many urgent cares. It sounds like the state was caught off guard by their existence a little bit.
Yeah, and the urgent cares have really been so helpful during this pandemic to do testing and contact tracing and, managing patients with COVID-19. So they've really been out there, and many of them have told me they feel like they've been, they've been pushed aside. And
Well, this is obviously a little bit troubling, and it's, sometimes it's hard to tell with the state of Missouri when it's a fact of not having a plan or when it's an inability to communicate a plan that's out there, and that can be as frustrating for reporters as it is for what you're dealing with right now. But certainly this raises a lot of questions. I do want to bring Sarah Fenton. She's the St. Louis Public Radio health reporter who we were talking to earlier. She is still with us here. Sarah, do you know if this issue is on anyone's radar at this point?
Well, I think it's definitely on the people who are not getting the vaccines radar, and I'm so happy that Dr. Vo is bringing it up because I know, I've been tested for COVID, I think 3 times, and every time it has been at an urgent care or a drive-through with CVS or something. And so these people, they're working like they are the frontline workers when we talk about frontline workers, and I can see how it would be really frustrating for people who don't work within an umbrella of one of these huge hospital systems to feel like, hey, we're where do we fit into all this? Where's the plan? And also seeing all the celebration that's happening when the first vaccines come, which is, like Dr. Vo said, it's awesome to see. It's heartwarming after so many months of just, stress and death. But it goes to show that like there is a limited amount of vaccine doses early on. They're going to specific places. I know that Dr. Williams from DHSS has said that healthcare workers who work with COVID-19 are first priority, and he expects everybody in that, he calls it a tier, but everybody in that group will likely be able to get a vaccine by the end of February. But the plans for that are still a little murky. They haven't been communicated by DHSS very well yet, and obviously not to the people who work at private clinics and urgent care centers and outside of these larger hospital systems. So, yeah.
In light of some of these murky details, Dr. Vo, what would you like to see happen here? Say somebody in a position of authority happened to be hearing this conversation. What would you want them to do here?
Yeah. So at this point, we have all written letters to DHSS and to our state legislators, and we've heard the same message back. At this point, there's limited supply, and you will be able to sign up to be a vaccination site. Up until then, we just don't have the ability to do this for you. And the reply that many of my other colleagues have said is, we are happy to take the day off and come to the hospital and get our shots there. Mm-hmm. We are happy to bring all of our staff with us. And for my clinic, it's 5 people. It's not like there's a large number. And it's not, I think that for me, I will be fine. I will be able to get my vaccine through Mercy South. But I think that knowing that we're on some list somewhere, if my father's on a list somewhere, I can start, arranging for when he'll be able to get the second dose, when he'll be able to return to the clinic to start seeing patients again. And, some of these physicians feel that they're not even on any list and not on anybody's radar. So I think that if the Board of Healing Arts can reach out to all the physicians that they license in the state, all of the nurse practitioners and the PAs, and give us some communication of where to sign up. Is there a list somewhere? Can we email somewhere? Can we put on some type of list so we know that at least our name exists somewhere, so that between now and February, if that's the plan, it's to vaccinate all of these frontline healthcare workers who are taking care of COVID-19 patients, that we're on some type of list. That's all we would like to know.
Well, that seems only fair to ask there. I think that's really helpful. I mean, they should be doing that. And I think we are going to stay on this story. And Dr. Vo, I appreciate you bringing this to our attention. I think this is something we should all keep an eye on in the next couple months. As Sarah said, there's more doses coming. And while this initial group of doses is very small, as more come, it seems like this is something where the state needs to communicate with these physicians. And Dr. Vo, I know you were willing to also stay with us here and answer some questions. And we do have one that this kind of just led right into. On our Facebook page, Sarah of St. Louis is asking, what are the logistics on the patient end of getting the vaccine? I don't know if either of you know this yet, since, as Sarah Fenton has said, the details are murky. But she's wondering, when there are enough doses for it to go beyond healthcare workers, will folks just be able to show up to a Walgreens or CVS and hope for the best? Or is there a queue? Sarah says, I'm trying to find info for my grandma, and I'm striking out. Dr. Vo, do you know anything about that?
Yeah, absolutely. So we have signed up to be a vaccination site. We were told that it may be a few months because my clinic being small and I didn't have it set up where I had the vaccines for children, set up also being an internal medicine clinic. My father, as a pediatrician, did have that when he had his practice in Sullivan, Missouri, in rural Missouri. And so it's going to take a few months, is what we were told, to be able to go through that process to be signed up for the VSC program. From there, we will possibly be able to sign up for phase 2. And for phase 2 is when I think that more of the general public will be able to be vaccinated. We've already in our clinic started a list. So starting a list is not that hard to do. We've started a list with people's names, how many people are in their family who would like to get the vaccine, who are 16 and older, and a phone number so that we can contact them. So as soon as we know when we would get those doses, we can start right away setting that up. And we already have an outdoor tent set up so that people can just drive right on through, get that vaccinated. We've got our process. We are ready.
Wow, you are ready. That sounds amazing. Sarah Fenton, in general, if people aren't a part of Dr. Vo's clinic where they already have this system down, does it make sense for people to reach out to their provider and get their name on a list at this point? Or is that a little bit of jumping the gun?
I mean, I think it's always good to talk to your doctor if you have a medical question. I am pretty sure that will eventually see vaccine clinics like you do with flu clinics. I'm pretty sure, we'll see them, health departments, I know, are planning to, do big vaccination days in like gymnasiums and in parking lots and that kind of thing. And eventually you will probably be able to go to, your drugstore close to you and be able to get a COVID vaccine like you will be able to get a flu vaccine. When that is, we still don't know exactly. Randall Williams, who's a state health director, has said everyone who wants a COVID vaccine will likely be able to get one in midsummer, so July, August. So we still have a way to go, but it's not like it's going to be a difficult thing to find. They're trying to make it as available as possible.
I'm going to go to the phone lines. Jeff is calling from Ferguson. Jeff, hi, you're on St. Louis on the Air.
Hello there.
Hi, thanks for joining us.
I was wondering, if a person is already quarantined because they've been recently tested, can they still get the vaccine?
You mean eventually, or you mean like right now?
Well, no.
Oh, Jeff, you still there?
I think you might have gotten a false positive or something. Can they still get the vaccine?
That's a good question. I think Jeff is wondering if somebody's already been diagnosed with it, would they be eligible to get this vaccine? Dr. Vo, do you have any sense of that?
Yep, absolutely. So we are telling patients that it will be 90 days because we do know that you will have a little bit of protection with antibodies for at least the 90 days. So per the CDC guidelines, wait 90 days after you've developed COVID-19, and then from there on out, you would be able to get the vaccine.
Ah, okay. Well, thank you for that question, Jeff. Sarah Fenton, here's a question for you. This is coming from Amanda. She asks, the vaccine is a 2-shot vaccine. How are boosters scheduled? And when they say we have 500,000 vaccines, do they actually mean 250,000 because of the need for that second shot, that booster?
Good question. And what the state health department has said is that for every, so both the Pfizer and the Moderna vaccines, both are 2-shot doses, or, well, I guess 2-dose shots. They're a vaccine that requires you to get 2 shots. And so I think the Pfizer one is 3 weeks. I think Moderna might be 4 weeks. And so when you get that first shot, whether it's Pfizer or Moderna in the future, your second shot will also be Pfizer or Moderna respectively. And if you get one, the federal government, Operation Warp Speed, has guaranteed shipment of another dose. And so when someone says, let's say, 50,000 doses, what they actually mean is 100,000 doses. And so they're including that second shot in that dose number.
Okay, so when they say that 3,000 went to Mercy, they really mean there's enough to vaccinate 3,000 people. There will be 2 doses for
so
each of those.
Another 3,000 will be coming for those second doses.
Okay, well that is good to hear. So it doesn't mean that there's half
so
as
you don't
many
have to
as
cut
what
it
we've
in
been
half.
told.
No.
That's some positive news. Here's a question. I'm going to send this to Dr. Vo because this seems related to your problem, the problem of being a more independent clinic when these big hospitals are getting the doses. Do we know anything? What about elderly people who aren't in nursing homes? If you're sort of an elderly person who lives on your own, do we have any sense of what kind of tier they fall in when they'll be able to get this vaccine?
Yeah, per the American College of Internal Medicine, in the CDC website, the adults over age 65 are in phase 1. But there's 4 tiers. There's the healthcare personnel, and then essential workers are the second part of phase 1. The third part of phase 1 are adults with high risk medical conditions, and then the fourth part of phase 1 are adults over age 65 in the community, and as well as skilled nursing facilities and assisted living facilities.
Okay, so they'll be behind a number of workers, but they'll still be ahead of the rest of us.
Correct.
Okay. Well, that's good. And is that something then where they would be showing up at a clinic like yours and just need to present that they're over 65 and they'll be able to jump the line, so to speak?
Yes, if I'm able to be a vaccination site for phase 1, but I'm at this point was told that I likely will be in the phase 2.
Okay.
More for the general public. But I do have friends who have pharmacies who are already signed up, and they have been told, the pharmacies have been told that they will be a phase 2 location.
Okay. We also got a question on our Facebook page from Colleen who writes, should those with autoimmune diseases like lupus and mixed connective tissue disease be prepared for stronger side effects or receive their doses differently, like receiving 3 shots instead of 2? Or is this more or less like a flu shot? Dr. Vo, do you know the answer to that?
So I believe I was reading some information about this, that there is a bit of a those patients will need to be watched a little bit closer, but likely will still be able to get the vaccine. And I don't think we know whether they would have to get a lower dose or if that dose changes. But those who are immunosuppressed will likely just have to be watched closer.
Okay. I'm going to go back to the phone lines. Max is calling from Veronica Park. Max, hi, you're on St. Louis on the Air.
Good morning. We've all heard that the 3 former presidents, Barack Obama, George W. Bush, and Bill Clinton, some time back have offered to getting their shots live on television. And I think here locally, the St. Louis leadership should do the same. And I mean, maybe before Christmas. I mean, now Lyda Crewson is like around 65, so if she were just a regular person, she would be getting one in January. But you see, since they are the political leadership and they would be doing it to instill confidence, it doesn't matter. I mean, I know Sam Page is under 65.
Right.
I'm not a bit bothered by that, although I'm greatly bothered by issues of fairness and all that sort of thing.
Well, Max, I appreciate your point, and I'm kind of intrigued by this question, and we're going to get to some public health messaging in the later part of the hour here. But I am curious, Sarah Fenton, if you have thoughts on this. On one hand, I hear people say, oh, celebrities ought to get this, politicians ought to get this, because this is showing to people that it's safe. On the other hand, you have people who might be desperate to get their hands on getting this vaccine, and they're saying, wait, why do the prominent people get to go first? What do you think of that quandary, Sarah?
I think it's an interesting quandary, and I think my take on this is whatever reaches the most people to show them that this is a vaccine that people should take seriously, that they should, that they should get, that's safe for people. I think that's a service that's good. I don't know, like, if presidents really, like, is that really the celebrity that is the most, like the most effective at doing that? I don't know. But
does that move the needle?
Like, I don't look
the
at
needle anymore. Who knows?
I don't look at like George Bush's Instagram every day. You know what I mean? But like, I think that messaging is really important, and it's something that we saw with those 20 people that received the vaccine on Monday. Is that they chose a big group of different people of different ages and races and job titles for a reason. And it's also something, the first person who received the vaccine in America was a Black woman, and the person giving the vaccine was also a Black woman on live TV on CNN in New York. And I think that was not a coincidence. I think that, especially when it comes to races that have been disenfranchised by the medical establishment for so long, it's really important to show that not only is it safe to receive, but the people who are giving it are people of all different kinds of races. And, I know in the Moderna vaccine, one of the, lead scientists on that vaccine was a Black woman. And so I think that kind of messaging is really important right now, because there is a lot of distrust in certain communities about testing and, being guinea pigs in particular. And it's something that messaging is really important. So yes, I think, obviously like 99% of vaccines should go to, these high priority people, older people, people who work in, healthcare settings, who work in nursing homes, because that's the most effective way to keep people safe. But I think that you can take, like a few hundred vaccines and look at who has, the most influence. Like LeBron James could get a vaccine, I don't know, Taylor Swift. It'd be a really good idea.
Dr. Vo, you agree with that as well?
Yeah, I do. As physicians, we have kind of been talking about this the last few weeks and said we're going to use the hashtag "This is our shot" to show the public that we are willing, we understand the vaccine, we are excited and we're willing to take the vaccine as role models. But I agree that there are people who are influential, whether it be celebrities or political leaders, that does help to instill confidence in the vaccine. And I speak for myself, and I believe for many in the healthcare field, that we would be more than happy to delegate some of those vaccines to those people, because we know how much impact that would have. And when our society is willing to take vaccine, what a big difference that'll make.
Well, that's actually a perfect segue to what we need to talk about just after the break. And so I want to thank you both for joining us today. You've both answered so many questions, and it's been so invaluable. And I also appreciate, Dr. Vo, you putting this really important issue on our radar. And we are going to stay on this issue of how people at urgent cares and independent clinics are being treated in this process. So Dr. Mimi Vo, thank you so much for joining us today. And St. Louis Public Radio health reporter Sarah Fenton, thank you.
Yeah, bye-bye.
Coming up next, we'll talk about the messaging around vaccines for the communities who need it the most. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU. Welcome back. We've been talking about the rollout of the vaccination program here in Missouri, and we've talked a lot about people who are eager to get the doses and having a hard time getting their hands on them or waiting for the moment when they can. But plenty of people aren't so sure they want a shot, and persuading them to come to the table is a public health priority. So joining us today to talk about that effort is Matthew Kruder. He's a professor of public health at Washington University, and his team is part of the federal government's national consortium of researchers working to increase COVID-19 vaccination among underserved Americans. So, Matt, thank you so much for joining us today.
Thanks, Sarah. Happy to be here.
So, Matt, is there really a sizable group of people who are unwilling to take this vaccine?
If you believe the polls, it looks like maybe as many as 40% of the American public would be classified as vaccine hesitant. This is kind of a term we're using now. But even that, I think, is a little misleading, because that broad classification of vaccine hesitancy is really not one thing. It's several different things. So there's a large segment. We think the largest segment of that are people who are just unsure. They're just uncertain, and they might not know what to make of a vaccine that was developed so quickly. Like, was it rushed, and what should they think of that? There's another group that we believe is actually much smaller, and that's people who are actively opposed. You can think of this as kind of the anti-vaccine segment. And they really believe they're not just unsure, they're really opposed to it. And then there's a group, and this was mentioned by your guests in the prior segment, where there's a lot of mistrust and distrust, often due to sort of historical reasons, especially among certain subgroups. And so the way that we have to approach each of those challenges is really quite different.
So is this something the federal government is cognizant of, and they are working towards different approaches for these three different groups?
Yes, absolutely. So again, I think your guests in the earlier segment did a great job pointing out that the impact of COVID-19 has not been distributed equally across all Americans. So older and sicker adults, Black and Hispanic Americans, those with low income, those with low access to health care, they have all borne a disproportionate burden of infections, of hospitalizations, and of deaths. And the government is, I think, highly committed to not repeating or exacerbating those sort of gaps and inequalities. And so it's a very high priority that we assure that as the vaccine rolls out, we really do everything we can to make the vaccine as available as possible and as attractive as possible to groups that need it most.
You talked about some of these groups that have a mistrust of these type of processes, frankly, because there's a history where they're smart to have a mistrust of some of these processes. What can the government do, or public health experts do, in cases like the African American community, where in the past, their bodies were used for experiments?
Yeah, so it's a great point. This is one of the tragedies, I think, in the history of my field and in medicine, that there were many examples of medical experimentation without the permission of Black Americans. specific examples including men with syphilis left untreated and tracked to see the long-term damage to brains and bodies, and gynecological experiments and sterilization on African American women. And so there is a healthy and frankly deserved mistrust and distrust with medicine, with healthcare, with science and research, and with government. And those are the sectors that are all involved with rolling out a new vaccine. So I think acknowledging that to begin with is really important. And then I think one of the ways that you counter trust issues is you determine who are the trusted sources for those same populations, and don't assume that they will be government or healthcare or medical professionals, and don't assume that they would be celebrities either. And so this is where in health communication you really have to be a good listener and observer, and figure out who would it be that would really make a difference. And I would add here that I think the idea of social norms is going to be very, very important. And so we know that people are more likely to take health actions when they see other people like them doing the same thing. And so the examples that you all were discussing before about who is seen delivering and receiving the vaccine in the kind of public rollout of this is indeed really important.
Is this also a question of access? I mean, someone like Dr. Mimi Vo, whose clinic largely serves an underserved minority population in St. Louis, should those types of clinics be given priority? Would it even be possible to give those kind of clinics priority so that they'd have so many doses available, say you wouldn't have to wait in line or do the sort of things that can make it harder to get a vaccine?
Yeah, I'm really glad you brought that up, because we should never view this as simply a kind of a communication or messaging challenge. There's not going to be a one-size-fits-all magic bullet message that if it just gets out there with a campaign, people will line up and wait for it. We're going to have to make it very, very easy and simple for people to get this, and that does mean making the vaccine widely available in places that are most convenient for the populations that are at greatest risk.
It feels like something we blew in some ways at the beginning of the pandemic when we were talking about testing. Should we trust now that we're going to be on top of this when it comes to things like vaccines that, frankly, have even more challenges, some of these storage issues and how cold they have to be, things like that?
Yeah, I think those are all legitimate concerns. I think what everybody recognizes that's a part of this is that it's going to take partnerships and it's going to take coordination. And that's at all levels. So there are logistical, sort of delivery and availability and accessibility issues. And there are also communication issues where we need everybody to be on the same page with kind of core messages about the vaccine and with understanding the benefits of the vaccine that are going to be most meaningful to people. I will say this, I mean, the COVID vaccination, I think, is different from other vaccinations in at least one really important way. When we promote, in public health, when we promote vaccinations in general, it's kind of an odd proposition. So we're saying, we'd like you to take this vaccination. You may or may not need it. You may or may not be exposed down the road, and that exposure may or may not come anytime recently. That's a whole lot of ifs. I think with the COVID vaccination, it's quite different because the benefits are going to be very concrete and much more immediate to people. So it is not simply reducing the risk of getting COVID, but it's it's getting permission to hug your grandma or to go back to work or to have a wedding with friends and loved ones. And I think that's a very different proposition from a health communication standpoint than sort of the vague, abstract prevention message that we often have to deal with.
I think that's a great point. Personally, I feel that so deeply in a way that I'm sometimes lazy about some of these health things we're supposed to be doing. I don't feel that way at all about this one. I want to go to the phone lines. Jim is calling from Bridgeton. Jim, hi, you're on St. Louis on the Air.
Yes, hi, good afternoon, Sarah. Thank you for taking my call. I'm a chemist by training, and I'm also a participant in the WashU Janssen vaccine trial. And last week, my son told me that he would be willing to get the Pfizer vaccine, but not the Moderna vaccine.
Oh.
I believe, if I understand it correctly, the Moderna vaccine is an RNA-based vaccine. And actually said that he believes, and he'd been told that the the Moderna vaccine would actually have the potential to be affecting his children. It would actually, the RNA would reach into he didn't understand it in this terms, but the RNA would reach into the germplasm and be carried on to the next generation. And I think there needs to be a really aggressive campaign by everyone, scientists, journalists, science educators, to explain what these vaccines are and how they work in terms that someone who just has a high school education could understand. Because when I heard that, I was flabbergasted. I'd never heard anything so ridiculous, I think, in my life.
And so, Jim, you're a chemist. Did you try to combat this misinformation your son had?
Yes, I explained to him what the difference between RNA and DNA and how RNA actually works in protein synthesis. And this is a RNA fragment that's going to challenge the body's immune system. It isn't going to make its way into the germplasm. It isn't going to make its way into his DNA. It won't be inherited by his children. But I don't think I got that across. I think he still believes it.
Wow. And Jim, you're so persuasive. Hearing you now, I'm like, man, we need to get this guy on the air to combat some of these myths. Matt, Jim is doing a great job here. He's having trouble even with his own son. Does that make you fear for the future of this campaign?
Well, I guess I would say if the plus side of the COVID vaccination is that there may be immediate tangible benefits, I think one of the really complicating factors is that we live in an information age where misinformation is rampant and spreads so quickly. And so combating misinformation is going to have to be a central part of the effort to vaccinate the American public. And the way that you do that typically is, first of all, you've got to be monitoring what sorts of information is out there, and then you need to be responding to it quickly and consistently. And we can't assume that simply a single response will change minds forever. The other point that I think is really important about responding to misinformation or even some of the active opposition that I mentioned before is that we need to treat all of these concerns as legitimate perspectives and not be dismissive of them, not be contradictory, not be judging or shameful. But as the caller, as Jim mentioned, really try to explain things so that people understand and provide balanced information with a more compassionate approach. Combative and divisive might be the current norm in political discourse, but that's not going to work when we're trying to educate the public about a vaccine.
I think that's a great point. I want to thank Jim for that call. That was super interesting. Matt, we just have 1 minute left here, but you talked about combating this misinformation as it pops up. You just can't have one single message. Does that mean public health people need to be getting down in the ditches on Twitter and Facebook and fighting with grandma who's spreading misinformation? That sounds like really hard work.
I don't know that they want to be fighting with grandma, but they want to they want to hear and understand what is being shared with and by grandma, and they want to have responses that are immediate and informative. We actually know we also know what you don't do. What you don't do is repeat the misinformation, which tends to sort of give it longer life. But you want to put up against that what the facts are. So absolutely, public health must be and will be monitoring actively misinformation in social media and other places and responding to it.
Well, I guess that should give us some hope. You guys are going to be keeping an eye on the cesspool that's online. And boy, I'd love to see some of these things getting combated. So this has been so interesting to learn about this work and what it's going to take to have this succeed. Matthew Kruder, I want to thank you so much for joining us today.
Thanks, Sarah.
This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations. And leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thanks.
Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.